last time we were talking a little bit about the questions that any microinsurer would need to answer in terms of implementing a microinsurance model. So the first one was sort of the suitability of the product in its environment. Secondly being what sorts of things a client is actually looking for in a product. And third being the type of marketing or distribution that might be applicable. The thing is that these questions seem like they could be applied to any product, any industry. So my question is, what sort of makes it different for microinsurance?
Well, to start off with, microinsurance is a sector of diversity. You know, there is diversity of choice in the product category to start with. There is life insurance, health, property, agriculture, and livestock insurance. There is diversity of distribution models, right from partner agent models to full service model and others. There is diversity of institutional setup as well, the government, commercial insurers, microfinance institutions, bank and insurance companies. So this diversity makes this whole mosaic of microinsurance complex. And the second level is that these diverse choices are often mutually exclusive and often require disproportionately costly investments. For example, creation and supervision and management of a efficient health service network is a prerequisite for any health insurance program. So if an institution has already decided that they will start off with health insurance program, they cannot revoke that decision without foregoing the investment that has already been made in creating and the health and service network. Life insurance, for example, it's a long-term, mostly long-term products. So even if the program is not successful or not sustainable, it has to be covered for the entire product life cycle. So in one hand, this diversity of choices and the costly investments makes the cost of revoking any strategy in microinsurance very high. That's why a careful observation at the first level, careful observation and decision about the sector, the industry, the regulation is a prerequisite.
So how do you sort of resolve these dilemmas then?
So in MicroSave, we generally try to follow a choice pyramid, so to say, which has 3 layers. The first layer, of course, being the institutional assessment and regulatory assessment, environmental assessment to be precise, which answers the first level of questions, which is which product type should be piloted. The second level is about the client demand. What is that the client want, and that is addressed by a market research, detailed market research. And the third is institutional setup, which decides the analysis of institutional setup, which helps us decide the distribution model and the marketing model that an insurance program, microinsurance program should follow.
So basically, last time we were looking at the environment side of things, which is really looking at the supply side, and sort of that's how that fit in.
In a sense, yes. A sector report actually helps us in doing that. But to take a decision, strategic decision, one has to look more closely and find out a fit between the organizational structure and the environmental factors. So that has to be done in propriety. And which takes us to the next level then. It's about market demand. What does the client need, and how the product should be made? What should be the product features?
So in terms of that, what sort of questions specifically are important to ask when you're looking at market research to try to scope this out?
Well, if we try to deconstruct the whole client demand part on microinsurance, it comes down to 4 different sub-segments, so to say. The first is that risk perception. How does the client perceive risk in a particular product type or product category? Second is about the product attribute preference. What kind of attributes are preferred by the product? The third is the client affordability and willingness part of it. And the last but not the least is the client awareness for microinsurance or insurance as general. So let's talk about the risk part of it. So in a particular product type, there would be different risks. For example, in health insurance, there would be whether the client faces risk in primary healthcare or secondary healthcare or tertiary healthcare or inpatient or drug-related costs. That is very useful to understand, because that is how the product would be designed. Product attribute preference is the next category, where we have to understand that whether a client prefers or gives more importance to a particular product feature or not. And that we do through mainly through these 3 quadrants, 3 points in a positioning triangle, which is whether they're price sensitive or quality of product sensitive or service sensitive.
The idea is that there's sort of three types of things that clients might prefer more than others. So you've got the cost on the one side, sort of is the price right? Second, you've got the service quality itself, and then you've got the product quality itself. So I guess it's important to scope this out because from person to person or segment to segment, these preferences might differ. But then sort of going through all of this, you also need to fit this into the organizational structure. So does it suit the organization? So I guess my next question would be what types of models would you think would be applicable for this? What's the best type of model that might be out there for this?
Rosalind, there is no easy answer to this question. Models vary and so does their suitability. Some particular product might be suitable for agent model, some other would be for bank model, some other would be for bank agent model, say to say. So what is necessary to understand is that the suitability of a particular distribution model varies according to the segment and according to the product types. The cost of each distribution model is different, and so is their suitability to a particular segment. In insurance industry overall, there is an issue that we always consider that all the product types could be sold by all the distribution models, which is not the case. In case of microinsurance, so to be precise, based on, in one hand, we have complexity of the product and the level of specialization that a particular distribution has. On the other hand, the level of service that a distribution model can give and the effort that is required for selling a particular product, we can map different product types into different distribution models, and that is where it needs to be cast at. And for example, a credit life microinsurance can be suitable for MFI or a bank teller based distribution channel, whereas I am not very sure whether a voluntary health insurance product can be sold through exactly the same distribution model, and if it does, it has the modalities around that should be changed.
So that's really interesting. I think that's a great place to stop. Maybe next time you could talk a little bit more about client awareness. I think it's really important, especially because client preferences change locality to locality, and this is sort of a vital piece to get correct if you're implementing a microinsurance model.
Sure, that would be really a nice thing to do.